welcome to all of you who have joined and to those of you still logging in. My name is Lizzie Pulgarone, and I am the Promoting Behavioral Health IPC lead along with Julieta Hernandez, and we're really excited to host today's grand rounds. I'm going to go ahead and start introducing our speaker today. We're really excited for everything she has to share and want to leave some time at the end for questions. She also mentioned if you'd like to put any questions in the chat or throughout the presentation, to please go ahead and we can address those as they come up. But again, thank you all for joining us on a Friday afternoon. I know it is chilly and hard to adjust for those of us who are not so used to the cold, so I appreciate everyone's effort in being here today. I'd like to introduce our speaker. Her name is Dr. Emily D'Agostino. She's a community engaged researcher and social epidemiologist focusing on reducing health inequities. Dr. D'Agostino's research draws from over 20 years of experience working directly in school and park settings to develop, innovate community-based strategies targeting the social drivers of disparities in physical activity, obesity, fitness, and mental health. She holds expertise in all of these areas, and as well as multi-level modeling techniques, analysis of complex longitudinal data sets, and methods of epidemiology instruction. Dr. D'Agostino serves as a PI on the Youth Empowered Self-Care, or YES, program, and Going Places, a study to promote youth well-being and physical activity in close collaboration with parks and recreation programs. She also serves as the co-PI on the UNME Test and Treat study and the co-I on the Rapid Acceleration of Diagnostics for Underserved Populations, otherwise known as RADx-UP. That program coordinates 143 research projects and develops community-engaged research capacity nationally to reduce COVID-19 disparities in underserved populations. It is through our RADx collaborations that I had the pleasure of meeting Dr. D'Agostino. She is currently an associate professor of epidemiology at Duke University School of Medicine, the Department of Orthopedic Surgery and Population Health Sciences. She is also the associate editor of Childhood Obesity and the director of community engaged research practice in the Duke School of Medicine of Occupational Therapy Division. On behalf of our Promoting Behavioral Health IPC, I am honored to welcome my colleague and dear friend, Dr. Emily D'Agostino. Thank you for being here with us today.
Thanks, Liz. Can you hear me all right?
Yes.
So I'm going to request a favor, which is if somebody could just keep an eye on the chat and interrupt me if there are any questions. Thank you very, very much, everybody, for taking time out of your day, out of your Friday, and especially your lunch hour to join me. I'm very excited to talk to you about this study. It is near and dear to my heart, as is all of the programs that involve health equity and parks and recreation. So I'm hoping that you will join in and interrupt me and ask questions. I really welcome them. And I'm, again, just very appreciative that you're taking time out of your day to join me. So I'll go over some just general topic around Parks and Recreation and how Parks and Recreation can promote mental well-being as well as other health outcomes at a population level. I'm going to provide an overview of the Youth Empowered Self-Care study. We ran a pilot study about 9 months last year, so I'll go into detail as to what that study entailed. And then I'll also talk a little bit about our pilot findings and next steps. And again, I really encourage you to interrupt me at any point. So I realize, particularly with this group, I'm preaching to the choir, but just some background. We know that nearly 15% of youth globally, ages 10 to 19, experience mental health disorders. This accounts for about 13% of the burden of disease in this age group. About 70 to 80% of children with mental health disorders go without care, which is particularly for individuals who don't work directly with youth, pretty shocking. Between 2016 and 2020, the number of children ages 3 to 17 who were diagnosed with depression grew by almost 30%. And of course, we know with COVID, those numbers have gone off the charts, unfortunately. We also know that the U.S. Surgeon General made some recommendations with regard to youth mental health, calling youth mental health a crisis, and including recognizing that youth mental health and mental health overall is critical to health. So this is the fun part of the presentation where I get to hopefully encourage some believers around Parks and Recreation and my passion for Parks and Rec. So you may or may not know that some of my background entails working as a Parks and Recreation professional. I see that we have some folks on the call who are team members of this study, of this project, and I've worked with for over a decade, including before my time at Duke. So I was a in-house parks professional, epidemiologist for Miami-Dade County Parks and Recreation. Once I came to Duke, I started to collaborate directly with Parks and Recreation in Durham, and am a incredibly firm believer, passionate believer of the role of Parks and Recreation to promote health, to promote wellness, because of all the things that Parks and Recreation offer. Many of us know of Parks and Recreation in our local community. We may or may not use the services of Parks and Recreation, but once you do, you realize the extent of which they address all ages, all aspects of our lives, from social connection to music, to arts and recreation, to sports, mental health, and so on and so forth. So one of the things that I wanted to talk to you about is the shift in public health since the late 19th century. So as Liz explained, I'm an epidemiologist. I'm trained in epidemiology. Of course, epidemiology is central to public health. So in the late 19th century to most of the 20th century, public health was called sort of the 1.0 phase. So this is when most of the emphasis was on preventing and treating disease, on sanitation and food safety. This led to the development of vaccines and antibiotics. In the late 20th century, this shifted over to Public Health 2.0, which was the expansion to addressing chronic disease, also some new infectious diseases. The Institute of Medicine called for a shift in focus on these chronic diseases. But it's only more recently in the 21st century that we now are in what we call a Public Health 3.0 phase. This is a term that was coined by Karen DeSalvo. She was part of Health and Human Services and an assistant secretary to the state around 2020. And essentially, this is the idea that in order to solve the problems that we currently have with regard to health and health inequities, we need to be thinking about root causes. We need to be thinking about who needs to be at the table in order to address these, and who needs to be collaborating. And so she cast a very wide web or network in terms of who needs to be involved, who are the diverse partners in order to put health first. This was the diagram that I initially saw, which essentially has public health at the center. And you'll see it has all of these different organizations that we may or may not think are directly connected to health and wellness. So for example, schools, civic groups, nursing centers or homes, nonprofits, faith institutions, tribal health, law enforcement, drug treatment, as well as, of course, doctors, hospitals, and so on and so forth. And so one of the things that I like to do is usurp this image and put Parks and Recreation Center. And I think this is really important because, again, I'm such a passionate believer in the role of Parks and Recreation to move forward this idea of how do we mitigate health inequities and promote health across all populations. So the YES partnership, or Youth Empowered Self-Care, is, again, a collaboration or a collaborative effort across two different Parks and Recreation departments. So the first is Durham County, the other is Miami-Dade County. The idea here is that Parks and Recreation was put at the forefront. Parks and Rec actually came up with this idea. So I mentioned that I work on several Parks and Recreation based projects. I was having an informal coffee with one of my partners, my Parks and Rec partners in Durham, Jason Jones, who was, I think, maybe the second person I spoke to when I first got to Duke about the role of Parks and Rec to help with health inequities. And he had just visited, this is right, I think, at the end of COVID. He visited his son's school and was lamenting just how stressed out people seem to be, how anxious, how much tension there seemed to be in the school environment, and why weren't we doing anything with regard to how might Parks and Recreation make a difference. We both drink this Kool-Aid, which is that, Parks and Rec can have such an amazing influence on health and wellness, but we also know that Parks and Recreation are an underutilized resource in the community. So a lot of people are not aware of all that Parks and Recreation offers, particularly for youth. We might know about maybe sports, but we may not know about, photography classes and songwriting and everything from kickboxing to jobs and resilience. So Parks and Recreation has a lot to offer, and we knew this, and we started to talk about, well, what could we do to connect families, connect youth to Parks and Recreation, specifically to support their mental health needs. And as I mentioned, I was a park professional. I have a long-standing relationship with Miami-Dade County Parks and Recreation. And so we ended up deciding to work together with both Durham Parks and Recreation and Miami-Dade County Parks and Recreation in order to try to begin this new initiative. I'm based at Duke in the School of Medicine and the Duke Clinical Research Institute, hence the three icons here. And so our team is vast and wonderful and diverse in skill sets. So I lead this initiative together with Christoph Hornick, who is a co-PI. We both run a something called the You and Me Healthy Registry, which is a registry of participants across the nation who help us to design and implement studies that are needed in communities. And this is one of those I brought to the You and Me Healthy Registry team, this idea of why don't we take what the community wants in terms of trying to promote health and wellness through Parks and Recreation. And so together we instituted this. We have mental health professionals from Duke. We have project leaders. One of them I know for a fact is here, Princess Abbott Grimes. I'm not sure, I believe she might be the only one from our team here from the Duke side. We also have several folks who are our collaborators outside of Duke. So Liz Polgarone, of course, who introduced me. Eric Hansen, I see, is on the call from Miami-Dade County. And I'm not sure if any of our other teammates are. If you are and you're able to come off mute, please give a holler. But we have this wonderful team that is representative of, as I mentioned, many skill sets, both across the community and the Duke academic side. And I'm proud of that. So the goals of the Youth Empowered Self-Care Program were to link youth and families, as I mentioned, to park-based programs, both in Miami and Durham, with the idea that this might reduce anxiety and also promote mental well-being. We developed a set of screening tools to support youth, both in their sub and preclinical mental health needs. So this is not for the youth that needs emergency care or critical care right away, but rather somebody who can benefit from Parks and Recreation programs. And our hypothesis was that through engaging with Parks and Rec, that we might help to reduce their anxiety and promote their mental well-being. We also offered a reference library of resources online. We were hoping to better understand the characteristics of children and families who might utilize these resources, as well as identify barriers to community-based mental health resource use. So our plan was to recruit 150 families, 75 in each county, for this pilot. We wanted to do it over 6 months with the idea that we anticipated that we would connect with families, that some would drop out. We would hopefully have 100 families. And we also hoped to target youth between the ages of 8 to 12. We thought this might help us in terms of having the most connection to engaging with families, particularly because of our recruitment methods, which were directly to families. We hoped to connect them to these online screening tools. This would be our pre-survey. We would refer them to Parks and Recreation, both in Durham or Miami, depending on where they were located. We were hoping to recruit about 20 youth and families to participate in focus groups. And we would then administer a post-survey after they completed the Parks and Recreation program that they signed up for. And this is just a graph. This is taken from the Center for Disease Control and Prevention's Social Vulnerability Index. Many of you, I'm sure, are aware of several of these indices that are online, the Child Opportunity Index, the Area Deprivation Index. The SDI is one of these that helps to identify where are the highest need areas, the most under-resourced. And that's based on 15 variables from the US Census Tract that are then collapsed into 4 indicators that you'll see on the right. So socioeconomic status, household composition and disability, minority status and language, and also housing and transportation. And so the areas with the darker blue indicate those areas with higher need. And it just so happens that the location of the parks and recreation systems that we were engaged with, all of those parks were located in these areas with the highest need, or the darkest blue. So in Durham, you'll notice there's a large, in caps Durham, which is Durham County, and then smaller, which is the city of Durham. For Durham Parks and Recreation, those areas in blue are where the Durham sites are. And then in Miami-Dade County, many of you who are here on the call are based in Miami, so it's likely you already know that Miami has several different parks and recreation organizations that there's those that are connected to the cities or municipalities, and then there are those that are part of Miami-Dade County, which are for the non-municipal areas. And so Miami-Dade County Parks and Recreation serves the highest need youth, those that are in the non-municipalities. And so again, you'll see in these dark blue areas, those are a bulk of where the Parks and Recreation facilities are located. And this just shows the levels of the intervention for Parks and Recreation for the YES program. So again, we were hoping to provide individual intervention through online education, through connecting youth and families to resources, hopefully increasing their sense of community through their engagement in these programs. This also addressed the organizational or recreation center level, so connecting youth to programs at the organization level, to different composition and dynamics of peers, staff and mentors, programs, and then also potentially field trips and events. And then lastly, making sure that Parks and Recreation at the environment level was having an impact. So giving them access to green space, to facilities at the site level, as well as mental health resources, again, in the community level. This shows our timeline. So again, we were hoping to do this over 6 to 9 months. We started planning in October 2023, and then this lasted through the summer of 24. And I wanted to show you the program participant flow. So this is essentially when individuals were engaged in this program, what were the different steps that they would take. So again, they would first connect to us through online recruitment. I'll go through some more details in terms of how we recruited in a moment. And they would take these pre-surveys. They would then engage ideally in Parks and Recreation and attend the program, and then they would take the post-survey. So not super complicated, but something where, again, we didn't know if we would be able to connect with youth and families and if this would work. This is also what we call a direct-to-participant approach or intervention, where we were essentially trying to connect directly with youth and families through our recruitment methods. And then it was really on them to engage with the website, enroll, participate, sign all our consent forms, go through the process of enrolling in the program, and then take the post surveys. So this shows our recruitment methods. We had numerous images, flyers, QR codes, et cetera, et cetera. We had a website that's still live. We recruited through various social media, as well as word of mouth. And the measures that we used were offered both in English and Spanish, given the community that we were trying to serve with the intervention. So the two wellness measures were the Kid Screen 27 and the SCARED, which I'll go into detail in the next slides. We also collected demographic factors. We looked at program satisfaction and barriers to participate. I wanted to also note that the satisfaction and barriers were co-developed with Parks and Recreation. I should have mentioned all along that everything that I've mentioned so far, that study team that I shared with you, all of this was co-developed with that study team. So we had biweekly meetings, and everything from, the design of the flyers to what YES should be called. The name of Youth Empowered Self-Care actually came about by the partners helping us to decide, and actually they came up with that name. And so again, just really want to emphasize that this was extremely intentional in terms of being a community engaged, community centered project with the community partners coming, right at the forefront as co-collaborators. We also had process data, so that includes the program type that the youth were engaged in, as well as everything from the size of the program, the total sessions that they attended. We looked at need, feasibility, and acceptability of this program. So, were we able to collect the data? Did we enroll the right number of participants, et cetera? And then we also looked at community partner and website engagement. So this included the frequency and attendance of meetings, as well as website views, unique users, et cetera. And again, I know I said this in the beginning, but and it might seem like I have a flow, but please interrupt me. I really encourage you to ask me if you have questions. So as I said, this is the kid screen in more detail. This is a measure that assesses subjective health, psychological, mental, and social well-being. It is a sort of overall quality of life measure that we wanted to use to look at mental well-being. It's been validated for racial and ethnic minoritized and low-income youth, ages 8 to 18 years. It has good test-retest reliability. So again, with our pre and post-test, we were looking for certain measures that had that reliability. And it addresses 5 dimensions of overall well-being. This includes psychological well-being, physical well-being, autonomy and parent relations, peers and social support, and also school environment. And you'll see a sample of one of the excerpts from the kid screen. I should also note that there are several versions of the kid screen. There's a kid screen 10, kid screen 27, et cetera. And that refers to the number of questions within the measure, and they all have sort of validation for being used, particularly in, as I mentioned, racial, ethnic, minoritized, and low-income youth. This is for the kid screen 27 in Spanish. I should mention that there are many versions of the kid screen 27 in Spanish, meaning many Spanish versions. This is a global measure. And so one of the things that we asked our partners was to let us know, which measures seem to be most appropriate in terms of the community that we would be trying to serve with this intervention. This is for the SCARED assessment. So this is a measure of anxiety. It's a screening tool typically. There are 41 items within the tool, and again, tested for reliability and validity for anxiety disorders for both children and adolescents. This shows an excerpt on the right, and then also in Spanish. So I was going to pause for a second. I see there's something in the chat, but I don't see if it's a question.
It says, please describe the unique users of the YES website.
So unique users just means how many individuals with a different IP address visited the site. So that's what that referred to in terms of unique users. So if there were repeat users or people who visited with the same IP address, then we didn't count them twice. So the final enrollment, this is very exciting, and I'm shocked, but we did not end up with our eventual target, which was 100. We had almost 250 individuals or families that enrolled in YES. About 30% of them were from Durham Parks and Recreation. About 70% were from Miami. We had 247 who completed the pre-survey, 219 who completed the post-survey. Again, really great response rate. However, we had some trouble getting interviews. So we ended up with only 3. If you recall, we were hoping to target up to 20. But we did have 3 in-depth interviews. The demographics of our participants included, as you know, 8 to 12-year-olds. About 36% were Black, 34% Hispanic. We separately asked about ethnicity. We had 12% who were identified as Hispanic. 50% were female. The annual income, the most common was, which was at 40%, was 50 to 75,000. And the 40% of the parents' highest level of income, or excuse me, education, was high school or a GE. As I mentioned, we had biweekly hour-long meetings with our partners. and we had about 1,100 views and about 500 unique users. The mental health resources page was the most frequently visited page, and the highest enrollment was when we the highest visiting was when we were enrolling. So I'll go into some specifics as to pilot findings. So 99% of the participants, I should mention that all of the pilot study measures were addressed to the parents or guardians. So the parents and guardians completed the surveys on behalf of themselves and their children or family. So you should think of all of the responses here from the perspective of the parent and child. There are child measures for the Kidscreen and for the Scared, and I'll talk about in our next steps, how we'll plan to incorporate those in the future. So 99% of participants, based on the parents and guardians, indicated that they reached out to a Yes Connector to help them to select a program. Almost 90% were not already participating in Parks and Recreation at the time of enrollment, and 99% completed their Parks and Recreation program. 65% were satisfied, 34% were very satisfied with the Parks and Recreation program, and 51% agreed, 44% strongly agreed that their child seemed to be in a better mood after participating in the program. There was a 46% reduction in anxiety, according to the Scared findings. And the greatest reduction in anxiety was for those individuals who said that they were in the lower income categories. So comparing lowest to highest income, there was a 4-fold difference. Also, among Hispanic participants, there was a 57% higher decrease in anxiety than non-Hispanic, and a 73% higher or greater decrease in anxiety than white participants. There was also a greater reduction in anxiety for males, for those who engaged with or enrolled in longer programs. Those programs that had a longer duration per session, as well as those programs with some physical activity, but interestingly, not only physical activity. And I say that because much of my work is around physical activity promotion among youth. And we know very well that there is a strong connection between physical activity and mental health promotion. But the programs that seemed to have the greatest reduction in anxiety were those that had a mix of physical activity and non-physical activity. And the change in anxiety, interestingly, did not appear to differ by county, so Miami versus Durham, or group size, so greater than or less than 10 individuals. And I'm going to go into some more specifics because we have time, but again, interrupt me. So first of all, I'll talk to you about some of the detailed Kidscreen findings. So 31% of children or parents reported that their child had an increase in peer and social support. Also, 85% reported an increase on the psychological well-being subscale. I should mention that the change for peer and social support was not significant, whereas the change for psychological well-being was. Also, there were increases in peer and social support that were reported overall. So as an example, 44% initially, and then after the program, 14% indicated that they sometimes or almost never spend time with friends. Similarly, at the beginning, 28% reported, and then after, 17% reported that they sometimes or almost never have fun with friends. The psychological well-being findings showed greater improvements for boys versus girls, although they were both above 80%. And then also for peer and social support, 37% for boys versus 26% for girls. There was a greater improvement across the Kidscreen for subscales for Black and Hispanic versus those who identified as non-Hispanic white. And then also a greater improvement in psychological well-being and peer social support for those in lower income, as I mentioned on the previous slide. So for example, 100% and 75% of caregivers reported, this was in the lowest income category, 25 to 50K per year, showed increases in both of these scales, the psychological well-being and the peer and social support, versus only 64% and 21% for the 100 to 200K per year. Now, 64% and 21% are still impressive, but just interesting to note the difference. And then also there was a greater improvement in psychological well-being for those who were engaged in smaller versus larger programs for the kids screen. And this is an image that shows just the changes in anxiety and psychological well-being for both of the scales that we used, for the pre-test in blue compared to the post-test in orange. And you'll see overall, so you'll notice that on the left for the scared, we are looking for anxiety to decrease, hence the pre-scores are higher than the post-scores, versus on the right, we are looking for the kids screen or the well-being to increase, hence the increases from the blue to the orange. So I mentioned that we struggled with interviews. We did have 3 in-depth interviews. They lasted about an hour each. They were represented by 2 non-Hispanic Black, 1 Hispanic individual. 2 of the 3 were female. So the key concerns that they raised with regard to youth mental health promotion in their community were related to access to mental health, which of course confirmed, why we were offering this program. Also mentioning that, access refers to proximity as well as cost, as well as, the availability of programs locally. Difficulties in finding and navigating the existing resources that were available, transportation, time, and also safety concerns. Scheduling conflicts, of course, and then also limited access for those who were in underserved areas. And then in terms of YES, learning about YES, participating in YES, the participants in the focus groups said that they thought that YES was a valuable resource, that it increased mindfulness about engaging in activities and promoting mental wellness, and that it fostered social connectedness by providing these opportunities for peer interaction. So as I mentioned, Parks and Recreation, our collaborators were together with us co-designing at every step of the way. So they also helped us to co-design this dissemination 2-pager that we offered to the community. This provided a snapshot of our preliminary findings, why we conducted YES, our enrollment, our next steps, and we put this on our website. We had a QR code that we posted in flyers where individuals could access this. We included this in newsletters as well as other community networks. And then we also presented these findings at the North Carolina Recreation and Parks Association a few months back. We co-presented with our Durham Parks and Recreation, or one of our Durham Parks and Recreation partners, Jeff Ford. And so he presented these slides and they come directly from him, which, from his perspective as a parks professional, how does YES support or benefit Parks and Recreation, and what are the benefits to the community? So for the benefits for Parks and Recreation, he was saying that, this helped to promote connecting families and youth to Parks and Recreation, and ideally participation in the programs. So really recognizing that this is a resource that that is underutilized and that should be utilized more. Also promoting social connectivity to the community, making sure that we offered websites with resources that were easy to maneuver, offering low-cost, innovative solutions to promote mental health with more Parks and Recreation access, helping Parks and Recreation staff to offer new programs. So I would tell you that there are actually a few programs that they were not going to offer. And when the staff realized we were going to do this, they said, hey, this would be a good time for us to add this or add that. And so I know that there were some more mindfulness programs that were offered in Durham Parks and Recreation, or Durham specifically, as well as a songwriting class, as well as an extra kickboxing class. So that was exciting to learn that, immediately we had this impact on what was offered to the community, and that hopefully that would spur additional offerings. And then just exposure to the community in terms of, what are the programs that are offered at the center, and having more of a presence. And then in terms of benefits for participants, Jeff was saying that he saw that this helped to have youth learn new skills, planting a seed for future enjoyment, making lifelong lovers of Parks and Recreation, making sure that they understand that even if you go to a program that is, a few weeks long, or, has only 6 sessions, that it can still make a significant difference in mental health. You don't have to have a long, drawn out program to make a difference. hopefully fostering new friendships, which of course goes along with social engagement and socialization, and then thinking about the connection between mental health and overall health. And that, again, I know I'm preaching to the choir here, but this is a nice thing to make sure that more and more people in the community make these connections. So I said that I would offer some next steps. So one of the things that we did for our team is, or with our team, is we submitted an R1, which we'll see if we're supposed to have a study section in a few weeks meet, although with the climate right now, we'll see if that happens. And we hopefully will hear back on that R1, and if nothing else, get helpful feedback and resubmit. But we'll hear back in a few weeks. We have a manuscript that is under peer review. So we collected these findings, and again, it was important to have them in a dissemination piece that was accessible to the community in that 2-pager, and also present at conferences. But as well, we wanted to make sure that we got some findings into the scholarly literature. And so with that, that is all I have. You have my contact information. I would love to open this up for any questions at all. Again, I'm really thankful for your time, and I'm very happy to be here. And I'm also very happy that some of our team members have joined us.
Thank you so much, Emily. There's another question in the chat. I'm just going to scroll. Oh, there was a question about the programs, if the programs were free or low cost, or if you could talk a little bit about what was offered.
Absolutely. So the programs were free or low cost. It depended on the program itself. But by low cost, I can give you some perspective. So in Durham, a 6-week program might be $25 total. In Miami-Dade County, they run on a sliding scale. The programs, I didn't go into depth, but the programs had a little bit of a different everything from duration to number of hours to emphasis. So whereas in Durham, there are they were offered programs, across many different subject areas, types of skills, from sports to arts and crafts to nature exposure, et cetera, et cetera. In Miami-Dade County, we focused on one program in particular that had high enrollment, which is the Fit to Play program, which is offered for youth, grade school youth. It's offered every day after school, and is focused on physical activity, although it has homework help, has some mental health components as well. And so the idea was, again, we did some comparisons across the 2 different counties and did not find a difference in terms of the benefits, but we we're hoping to explore that on our next steps. I also mentioned that in the R1 that we submitted, we are triangulating data with data collection directly from youth and also from parents. So we're hoping to get a little bit more of a perspective, not just from the parents, but also from the direct participants. And then I think you said there was another question in the chat, and then I see Patrick has his hand up.
There was a question about transportation, if that was provided.
That's a great question. So one of my studies actually focuses, not this one, but a different one, focuses specifically on transportation equity and the importance of providing transportation and reducing transportation barriers. So in Miami-Dade County, transportation was provided from most of the schools that are in Miami-Dade County to the Parks and Recreation site. And then it would be the responsibility of a parent or guardian to pick up the child from the Fit to Play sites. And if you hear any noise in the background, that's my rescue Labradoodle who's getting anxious to go outside. In Durham, the programs, there was not transportation to the programs, although they actually are offered in most of the Parks and Recreation sites are offered in the communities where youth reside. So although there was not transportation provided directly from schools to Parks and Recreation, the Parks and Recreation is very proximal to the schools and to the communities that they serve. And then I'll also mention that many of the Parks and Recreation sites have a bus stop right next to them, and so youth will use the bus. For example, both the school bus can drop them off at the Parks and Recreation site, but also the public bus.
Thank you. I think maybe Patrick had a question.
Yes. So my question is to you, Emily. Like, does the program also to work on with young adults from the ages 18 to 26? Because I'm a youth transition coordinator here at the Center for Independent Living of South Florida, and that's the age range that we work here with our young adults.
That's a great question. So I would tell you that right now, no. But in our future, hopefully, yes. So right now, the program, the pilot was for 8 to 12. The other part of the R1 was to expand the ages through adolescence. But we have not yet entered the young adult category. But to your point, that is absolutely a youth, or excuse me, an age subset that would benefit from this, or we would think would benefit from this, and should be studied. So 100% agree with you that that should be a group that we include in the program.
I asked this question because when I saw some of the presentation, but I had to step out for a moment. That I like the idea of how it works, and especially because mostly young adults, especially males, have more anxiety, like going to the park, more
Yeah.
than young ladies, surprisingly. And personally, I feel that it has to do too with a lot of like maybe like post-traumatic disorders, like maybe like the bullying that they went through to school, and especially some young adults avoid playing sports because they kind of fear being bullied just because they didn't play it right, to put it this way.
Yeah. Yeah, I mean, absolutely. You know, if we can connect them more to the programs, and then they can have these positive experiences, that would be the goal. And there's no question that we shouldn't just limit it to the 8 to 12-year-olds. Absolutely. And again, you know, as I mentioned, I'm a huge believer that Parks and Recreation can support all age groups, not just youth.
Thank you. I would like to be in contact with you on one-on-one in the future.
Absolutely. Well, you have my direct email, so and Lizzie has my cell, so either way, you're welcome to reach out to me 100%.
Thank you.
Yeah, absolutely.
Hi, Emily. I think I met you at the mobile clinic
You did.
yesterday or 2 days ago. So I have two questions. I love the study because it's so broad in terms of, helping as many kids, not necessarily those at risk, right? Is like is a big chunk of the population, and get them involved um, in exercise and non-exercise, right? Activities and the parks. But I have two questions. One, is there a reason why depression symptoms was not included? I guess because, like we always recommend, right, as psychologists, for kids that are not really depressed, but with depressive symptoms, right, to become active, physical activity. It helps sleeps, it helps with, the depressive symptoms. So I was just wondering why there was not a depression screener included, because probably you would have seen a lot of good results, right? Like the more involved, the more connected. I work with a lot of kids that are immigrants and they don't feel connected to anybody because they don't know anybody, right? Or even where they're in school, but still they don't have close friends. They left all their friends in their country. So reconnection I think, would be a great tool, but as well as physical activity, right? And it seems like in their countries they used to play more, right, in the streets and outside, and here they're all like inside, stuck in a house with many people, right? So I was just wondering if that's one of the areas that would be great to assess. And I don't know if there was any differences too between like recent immigrants versus people that have been here longer, because I see to see those symptoms all the time, right? Like, and they don't have the money to pay for any of these activities or the transportation to get there. So it's like a very special population. But we have a lot of those here in Miami. You're mute. You're muted, Emily.
Sorry, I'm not sure how I muted myself. So we struggled with which measures to use. And to be quite honest, we thought about, maybe the moods and feelings or the PHQ, one of them. In the end, what we decided, we were also trying to manage, this is a direct to participant pilot, and we were trying to limit the number of measures we were using and also find some that looked kind of globally, because it's possible that we would have an impact on depression, like you mentioned. We were really targeting global wellness and prevention. So the idea was, to get those preclinical, to get those youth that, would benefit from the socialization from Parks and Recreation. So to that point, that's how we ended up with the SCARED and the Kid Screen. So the Kid Screen does have a psychological well-being subscale. And interestingly, that's where we found the most impact, right, was on that subscale of all of the scales. So to your point, perhaps we should add in a depression scale. But it was merely around, what are the total number of measures? What would be the burden on the participant to really encourage more engagement, particularly given this was direct to participant. We weren't, we did have monetary incentives that I believe it was $25. So it wasn't a large, incentive. And I believe that was at the beginning and also at the end. So the quick answer is you're probably right. I don't know, Liz, if you wanted to add anything there, because you were, directly with me with all of the conversations and deliberations about which measures to use.
Sure, I think, you bring up a great point. And as Emily mentioned, it's always hard in the beginning to decide which measures to use, and retrospectively, we can perhaps change our opinions on that. I think one of the things too, because we were focusing more on the younger ages, we went with something a little bit more global, and then anxiety or symptoms of anxiety. I agree, there's definitely potential for some sort of depression screener to look more closely at those types of symptoms. The other piece is just that we weren't monitoring, we didn't have a psychologist or a therapist, anybody to necessarily look and debrief with participants right away. There were some safeguards and like email kind of alerts and things like that, but because we were so removed, and to start, I think even for our partners and everyone involved, it felt a little bit more comfortable. But as the program grows, hopefully with funding, we'll be able to put in additional measures and have a more robust type of assessment for all of the participants.
Yeah, because I think this is a great program for a lot of kids who are also, again, not severely depressed or suicidal or anything like that, but, like they have some symptoms of depression, mood, and, sadness just from, like I said, like what the mechanics, or what is the process of, is it like the social connectedness? Is it like because they're receiving also some classes addressing mental health, or the physical activity, right? Because just that in itself, right, will improve sleep, will improve kids' energy, mood. So like teasing that apart, having a measure, an outcome like that would be great, I would love to refer kids from a mobile clinic there if we have it here, for sure.
Thank you.
Yeah.
Hopefully there'll be a new iteration.
Yes.
And I have to say that when we were starting to pitch this, we thought it was a little simple. Maybe people wouldn't be interested. You know, we pitched it to our, you know, as I've mentioned, I'm an epidemiologist. I've focused mostly on physical activity and a little bit on youth resilience. And so we pitched it to Liz, to some of our colleagues at Duke who are in mental health, and everybody said, "Oh my gosh, this is great. We can, you know, help to support youth before they reach that clinical need, and really try to connect them to things that are already in their community, you know, really adopting an asset-based approach where these are resources that already exist. We're just helping, you know, make the connections, doing the resource linkage. And then we were wondering, wow, will we be able to recruit anybody? And we were able to, and there was a lot of interest in the study. And then, you know, we presented at the North Carolina Recreation Park Association conference. We thought that, you know, is anybody going to show up? And it was a full house, you know, and so we're really excited because it seems like whenever we talk to people, this is something that, you know, is well received, and there's an enthusiasm behind it. And you know, regardless of your specialty, that it seems like even if you know, are outside the field of health, but you have you know, Parks and Recreation, and then you kind of tend to get behind it, which is great. I know that Elizabeth had a question in the chat. I opened up the chat so now I can see you. Did we get any data regarding if other children and families outside of the target range utilize and connected? We did not, but that is an excellent idea. So we did ask some questions in the focus group just around, you know, what they thought the value of the program was, et cetera. But we did not ask about other children, you know, who didn't meet the selection criteria, or inclusion criteria, which, you know, again, they had to be 8 to 12. So we did not, but that is a great idea. And you know, again, on the next study funded would be for 8 to 18, and then you know, I love this idea of expanding to the young adult population as well.
Go ahead, Austin.
Sorry, I couldn't find my raise my hand icon. I guess I don't know if it's as much of a question, and it might be geared a little bit more toward the Miami crew. But since transportation was like an issue that you came to find, I wonder if because I know the Underline, which is a Miami program that works with I guess you already know.
No, but tell others, because there's some non-Miami folks here.
Yeah, I guess it's a program that's public-private with Department of Transportation and Parks and Rec, where they are creating programs to bring the community together along the lines of the Metro Rail. So when Lizzie was talking about iterations, might you take a look at whether that is a positive factor, or bringing people together and maybe having some impact on some of these things you were investigating?
You know, I think that is an outstanding idea. I don't know if he's still on the call. Eric, are you still on the call and want to let us know your thoughts? Let's see if he's still here. So I did see initially Eric Hansen, who is, I think he might have left. So he's actually a director of recreation for Miami-Dade County Parks, and one of our collaborators. But I think that's a great idea. And I also, I was thinking about, you know, one thing that we would want to do with the R1 is expand the programs that we offer in Miami. So again, you know, the structure was a little bit different in Durham versus Miami. And whereas we didn't find a difference across the counties, we would love to look at more programs. And there are many programs that are offered to Miami-Dade County youth through Miami-Dade County Parks, as well as, you know, the Underline technically is not only to help with the active transportation and so on and so forth, but also, you know, my understanding is that programs could be offered there. That is, it is an area to recreate in, you know, to add more green space, to add, yes, more connectivity, but actually to be a place for physical activity, et cetera. So it'd be neat to see if there are any programs also offered in that setting, as well as, like you said, you know, if there's any connection between the Underline and then connection to programs themselves, and then this program. Yeah, very cool. I saw a comment, is Fit to Play program? Yes, so Fit to Play is still happening in Miami-Dade County. It actually has been ongoing for over 10 years now. Actually, I think we might be close to 15 because 2009, 2010 is when it started. And there are many studies that we've published on with the benefits of Fit to Play overall as a program. So if you don't know about it, you absolutely should check it out. But it's evidence-based to have an impact on kids' cardiometabolic health, which is fabulous. And then I saw a question about Liz, are we able to answer one more question? Is that okay?
Yes, please go ahead.
There was a question about Julietta asked about the racial and ethnic composition of the sample. And I'm wondering, is it possible to come off mute? And I wasn't sure if you were talking specifically about the low Hispanic population in the being 12%. We had so again, if you scroll to our results.
That caught my attention,
Yes.
but then I realized it's a combined sample.
Yeah.
And it's just that I cannot grab my head around the final composition. You know what I mean? I assume that it's neutralized, I guess, by the North Carolina community. But
Yeah, maybe.
I am glad you had such great enrollment too. Yeah.
Yeah, and to your point, I mean, it was across both communities, although Durham Parks and Rec also serves Hispanic communities. But one thing to note is that it's still just a small sample of who exists in these communities. So even though it was great that we were able to enroll almost 250 people, technically, this is still just a convenience sample. It's, who got the link and who got, and we had to cap it at a certain point. We had only so many incentives to give out. And if you got the link and then you sent it to your friend and text it to 10 people, then that was part of the sample. And so this is not meant to be representative of Durham or Miami. And so that's an important thing, is just to note that, we didn't do any kind of, special random stratified sampling or this was a convenience sample. Certainly.
Thank you.
Yeah, absolutely. Well, I'm going to go back to the last slide, which has my information. So you're very welcome to reach out directly to me or visit the YES website and learn more about the program.
Excellent. Well, thank you again so much, Emily, for joining us today. And we are excited to hopefully learn some good news about the potential of this program growing. Obviously, there was a lot of enthusiasm, and thank you all for your questions. I appreciate the discussion. I hope everybody has a lovely weekend and can stay warm. Thank you all again.
Thank you again.